Hi everyone, thanks for tuning in. This is the grand rounds that we kind of discuss, different types of disorders and things like that. I'm at Claire. So today we're going to actually be discussing personality disorders, and I think we're going to start a little bit off about the difference between a personality disorder versus just personality traits. If you guys maybe want to touch on that a little bit.
Yeah, well, I think a lot of times people think about your personality as who you are. A personality trait can be something that you identify yourself with, whereas a personality disorder is when it becomes to the point where your life is not functional in the same sense that it would normally be. So, yeah, I don't know if you want to elaborate.
Yeah, so it's a personality disorder specifically not only affects who you are, your self-identity, but it also affects your interpersonal relationships. And so it's both inward and outward to the people around you.
Most people come to therapy not because of a personality disorder that's bothering them. It's interpersonal relationships.
Mm-hmm.
They're having trouble with relationships in their life.
And some examples of things that, as we kind of talked about, they start to impact your life, and, where do you draw the line between a disorder versus just personality traits? Some examples of kind of the way it would affect your life involving a disorder would be inability to keep a job for longer than a few months at a time, or consistently having difficulty with relationships, either with family, friends, or loved ones. And we all have difficulties in relationships. I think that's just kind of something that's normal for every human being, but it gets to be at a certain extent that you haven't been able to maintain a healthy relationship for an extended period of time. So those are just a couple things that might clue you in as to maybe there's a disorder going on versus just personality traits that seem to be more challenging. We're going to talk about a couple different types of personality disorders, some being a bit more common than others. And the first one is obsessive-compulsive personality disorder. And it might sound familiar to obsessive-compulsive disorder and this, but not talking about the personality traits. So we're just going to kind of compare and contrast those two things so that you can kind of understand, the differences between the two.
Okay. Just so everyone is familiar with the category of personality disorders, there's a general criteria that all personality disorders technically fit. Just to go over a few of those points, like we discussed, significant impairments in interpersonal relationships and functioning, also self-identity and self-direction issues. A lot of times, you can have a significant impairment in who you identify yourself as, self-esteem issues, and what you think others think of yourself. So all of those all the personality disorders kind of fit those criteria, and then they become more specific to each disorder. So when we start with obsessive-compulsive disorder and comparing that with obsessive-compulsive personality disorder, the criteria generally say that the person's very strict regimen with how they live, list making. I know a lot of people can say that they're like that, myself included. But just a pattern of orderliness, perfectionism, inflexibility, and they're oftentimes aware that they have this condition. They know that that's affecting their life. And I don't know if you want to elaborate more on the difference.
Oh, definitely. A person with obsessive-compulsive personality disorder not only has this strict perfectionism in their work or in their life tasks, but they also replace that their relationships or even recreational activities like going to the park, going to the beach, or vacationing with work. So they just have an enormous obsession with detail. A lot of times they can't get things done on time if they have certain tasks at work and deadlines at work. They can't meet those deadlines because they just obsess over it to the point where if it's not done perfectly, it's not done. So, and they tend to carry that over and overdo it.
So I also think a lot of people get confused with obsessive-compulsive disorder, which is in a generally like a completely different category than a personality disorder of obsessions. And the way that the DSM-5 now categorizes or differentiates the two is that the personality disorder is considered ego-syntonic, which means it's not really distressing to the patient, but obsessive-compulsive disorder with all of the routines, obsessions, compulsions, repetitious behavior, it's actually distressing to the patient. So.
Anything to add, Jim?
Generally, when we're looking at someone with a personality disorder, we're looking at someone with a persistent pattern that is inflexible and maladaptive in their way of perceiving, thinking, feeling, and acting. And here at Sinclair, we take a person-centered, indirect method of dealing with an individual with personality disorders that combine cognitive, behavioral, and interpersonal methods where we deal with an individual. There's usually a mismatch between what the person desires and the actual outcome in their lives. And once we start to deal with these automatic thoughts, then we can cognitively restructure the person. And a lot of it, Caitlin, depends on a person's motivation for change.
Absolutely, and I think that's one of the more challenging aspects of these types of disorders is just that so often, they want to be different and they want to change and they just don't know how to do it. Personality is something that, is so individualized to every human being, and to be able to have to focus and hone in on, the problem areas of a personality and a disorder and be able to overcome them, it's kind of learning about how to do that because especially with personality disorders in general, there are some theories that discuss, some decreased serotonin levels and other types of hormones in the body that can cause these personality disorders. But at this point in time, those thoughts are actually kind of skeptical right now. We're not 100% certain that those are the deficiencies. And a lot of times these personality disorders may stem from childhood trauma or something that even happened in the prenatal period that we might not even know about that can kind of cause different changes in the different areas of the brain that involve personality. So I think that kind of leads us down the road of how do we treat these types of things. And it's hard because a lot of it's, medications aren't necessarily going to be the answer for it. And, oftentimes we don't really feel that medications are the answer to every problem that we're going to have, but particularly with these types of disorders, it's very challenging because, there's only skepticism as to whether or not these hormones are actually imbalanced or if it's something else going on with the brain and the way it even formed in, childbearing and all of that sort of thing. So it's definitely a challenging aspect. Another one of the maybe more important personality disorders to discuss today is borderline personality disorder. And the reason we kind of want to talk about this one more so than all of the other different kinds is because Sinclair, as just a unit here, we focus mostly on DBT therapy, dialectical behavioral therapy. And a lot of us, I just actually learned recently that DBT therapy was actually initiated for borderline personality disorder specifically. And now that we've come to learn more about it and how things work and what's involved with these types of therapies, we've come to realize it can benefit a much broader range of patients. Even mindfulness and things like that can help you whether you have any sort of disorder or not. So I think it's an important aspect to touch on today, to kind of describe, how we came about to, teaching these types of therapies. Do you want to maybe go over a little bit about borderline personality disorder?
Do you want to start this?
Yes, of course. So patients that particularly that you'll see that you start being curious as for, okay, do they meet these criteria? So a patient comes in and basically you're looking for really high sort of moods and really, really low. So what I mean by that is that they have very low self-esteem, tend to be have an unstable self-image, very, very critical of themselves, feeling really empty, very stressed out, very anxious. But they also can have, very high feelings. So, so that can be negative feelings as well. So as far as like suicidal thoughts and ideation, worry, panic, nervousness, but a lot of it is just unstable emotions. So they tend to have, that carries out through their entire life. So they tend to have very unstable relationships, so they can't, sustain relationships in their lives, whether that be romantic or family or friends. They carry over a lot of anger through those relationships, and then work-related relationships as well. So these patients tend to, go from job to job because they can't contain sort of the professional environment that is required of them at work.
Yeah, and I think sometimes in borderline personality disorder, you can see the paranoia, paranoid ideation, even sometimes psychotic episodes. And basically everything involved with the borderline personality disorder has to do with poor self-image of oneself, whether that was, I mean, we don't really know the cause, but whether that happened sometime in childhood or the prenatal phase or whatever, with the brain development. A lot of times this self-image of who they are is what sort of propagates these issues, and that goes hand in hand with a suicide attempt, self-mutilation. A lot of times with these patients, you really have to be careful because they could snap and do something to injure themselves or injure somebody else. So they need to have maintain stable mood so that things like that don't happen.
Absolutely. So I think that's a really great point to kind of help maintain some stability in the mood, especially with borderline patients. And the reason for that is, kind of as we discussed, these people or patients that are suffering from this can go from 0 to 60 at the snap of a finger, and sometimes they're not even really sure what set them off. And a lot of times these patients really read into relationships or certain actions or behaviors from others. They read into it much more and think of it as being more meaningful than maybe it is, So even it could be something as little as asking someone a question, and they could maybe take that very personally and think that there's a hidden meaning to that, and they kind of just ruminate and think about these things, and they think maybe there's something wrong with them, and it just kind of can spiral out of control over a very simple discussion, even at work or with family. And that's something to kind of be cautious of, because maintaining a stable mood is really going to be the key, I think, to kind of helping manage these patients.
Dialectical behavioral therapy was developed by Dr. Marcia Linehan specifically to deal with borderline personality individuals. And dialectical behavioral therapy, the dialectical means two opposites, which in this case would be acceptance and change. And acceptance doesn't mean that resigned that this is the way it's always going to be. It's acceptance as this is the way it's going to be in this moment, which can be a positive builder, a motivator for change. In dialectical behavioral therapy, the core of it is mindfulness, to be present and aware. The emotion regulation is particularly important for individuals with borderline personality disorder.
We actually have a question from Sven in our room here. Are all personality disorders rooted in childhood, or do some develop in adults?
That's a really great question. And actually, from my knowledge and my research, I haven't found that there really is a true answer to that. I think the way that they discuss that as far as childhood is concerned is those, our young brains are so easily moldable, and sometimes it might not even be a physiological thing that occurs. There can be some brain traumas and things that can occur at a young age, but sometimes, our small, forming brains are so able to be influenced that, we might be experiencing some childhood traumas or issues with family and things like that that might not actually surface until adulthood. So I think that's something to keep in mind and kind of have that in the back burner, that, these things can definitely show up in adulthood, completely but most likely stemming from some sort of childhood trauma or physiological thing that may have occurred.
Personality disorders should not be diagnosed in children, and generally they develop in early adolescence, throughout their teenage years. It's rare that a personality disorder would simply bloom in adulthood.
So thank you so much for tuning in and kind of listening to our discussion about, DBT therapy and personality disorders. And there's an array of different types of disorders in this category, but we just touched on some of the ones that might sound familiar to you, as well as, kind of incorporating the DBT therapies that, that we incorporate here at Seclair. And if you'd like to find out more, you could go to seclair.com. Subscribe to the Seclair video on YouTube for more videos, and follow us on Google, and join us live Mondays at noon so you can ask questions for us to answer during our clinical discussions.
Thanks.
Thank you.